Welcome to the Fairfield County Alcohol, Drug Addiction, and Mental Health Board's 2021 Annual Awards video event. Undoubtedly, 2020 was an unprecedented year for everyone, including us at the ADAMH Board of Fairfield County. Due to the global pandemic, we had to rethink our All-Star Celebration annual dinner. For continued social distancing reasons, this year's event is a video that we hope you will enjoy. My name is Dr. Jonathan McCombs, and I'm the current chair for the ADAMH Board. I'm also your host for this video, which would not be possible without your interest in the behavioral health of Fairfield County, as well as the ongoing efforts of our board members and staff, elected officials, network of care agencies, and pro bono counselors. Thank you all. It truly takes a village, and you are our village. I would like to introduce tonight's esteemed guest speaker. Please welcome Director Lori Chris of the Ohio Department of Mental Health and Addiction Services, who will be sharing her perspective on the impact COVID-19 has had on Ohioans affected by mental health and substance use disorders.
Thank you, Dr. McCombs. I'm grateful for the chance to be here for your annual award ceremony. I appreciate the opportunity to reflect upon the impact of COVID-19 on the mental health and addiction issues facing Ohioans today. And we know that our work to overcome these issues has been pivotal and meaningful in the lives of Ohioans in your community and across the state. We appreciate your partnership, the providers, the peer support, the Fairfield County ADAMH Board, all of the work that's been done at the local level to really help promote mental health and prevent substance use disorders, relapse for the citizens in your community. As Dr. McCombs said earlier, the pandemic has presented all Ohioans with incredible challenges, and the effects are undeniable. We've seen increased sadness and nervousness, anxiety and depression among people of all ages. We've seen people experiencing loss and grief, but maybe minor or maybe complex grief. Could be based on losing a job or losing a loved one to the illness, losing some functionality because of COVID-19, or just the disconnection that we've all experienced from the people, places, and things that we enjoy when we're not in such unusual times. And we know that there are more adults struggling with the use of substances as well. And we have seen an increase in overdose deaths that's been alarming, not just in Ohio, but across the country. In fact, this past year has been one of the deadliest years from overdose deaths driven by fentanyl in the United States, and Ohio certainly has been no exception. For those with existing mental health and substance use disorders, we know that the isolation and fear of the pandemic added new challenges to their recovery pathways, and we've been grateful for the opportunities that prevention providers, harm reductionists, treatment providers, and the recovery support community have created for people to stay connected to services and to continue in their recovery pathway as well. For others, the crisis has triggered new stress, new illness, and risky behaviors. And so we're not just supporting and promoting the mental health and wellness of those Ohioans who are already living with or recovering from mental illness and addiction issues. We're also supporting and promoting the mental health and wellness of every single Ohioan in a new and different way. And again, we appreciate the partnership of the Fairfield County ADAMH Board and all of your community partners in making this possible for your local community and the citizens there. Our universe of Ohioans needing support with mental health and addiction issues has grown exponentially this year. And the pandemic has pushed us to find new ways to meet their needs. Some things that we've done to help advance mental health access and substance use disorder treatment access as well would include telehealth and the expansion of that. In the earliest days of the pandemic, we worked at the state level and connected with providers across the state. Treatment, certainly, but also prevention and recovery support providers to put technology in place and to support the quality use of those new technologies to meet the needs of men, women, youth, and families in the community. With these efforts, we in the Department of Medicaid were able to change our regulations, so not only were those services able to be provided according to our regulations, but could be reimbursed through Medicaid as well. we recognized that not everyone had access to video technology. Not everyone was comfortable using it. We were able to expand to cellular, telephone service, or even landlines, especially important for those parts of our state and our communities that didn't have access to broadband services. This made services and supports available to more Ohioans than ever. And in our work with people receiving these services, we learned that they really valued the choice of coming in person to services or in receiving telehealth services. Increased choice meant increased access, decreased no-show rates, and increased use of services and supports throughout the state of Ohio. We also enacted wellness campaigns and worked closely with local communities to make sure that the messages were those that could be received in every community, but also that there were trusted messengers delivering those new pieces of information, helping people understand that it was okay not to be okay, and it's okay to ask for help, and further helping people understand that behavioral health care is essential health care and that our services in Ohio are open for business. Again, this created new pathways to care for Ohioans and helped those who were already receiving services stay in service. Because of reduced capacity at our hospitals, we reimbursed local ADAMH boards for indigent civil patients to be able to serve patients at private hospitals. This meant when we opened quarantine or isolation units at our hospitals and had to deplete the capacity in our 6 regional psychiatric hospitals, the men and women needing that inpatient level of care could access that without barrier through the private capacity that exists in our communities. We're proud to say that we've served hundreds of Ohioans through this model and built new relationships to meet the inpatient needs of men and women across the state. We've also increased access to medication-assisted treatment for opiate use disorder and naloxone, the overdose reversal drug. Medication-assisted treatment capacity was enhanced by allowing more take-home doses for those Ohioans who were prescribed methadone as part of their recovery pathway. And with the naloxone overdose reversal, we increased the availability and supply of this life-saving drug across the state and made it available through mail order strategies in addition to in-person pickup. We created easier on-ramps to care through resources like the Ohio Care Line. It's a 24-hour-a-day, 7-day-a-week phone service where men and women, families can call and get the emotional support that they need, whether it's caused by the pandemic or they have questions or concerns about their mental health or substance use. It's connected to the National Suicide Lifeline prevention providers within Ohio, and we're grateful to partner with them to continue this service. Since last April of 2020, we've served over 6,000 Ohioans, with nearly 2,000 of them being connected to care because of this in-person consultation and referral and support service. We strengthened the equity lens to our work so that all Ohioans would have access to care that was equitable in its quality and could begin to receive more equitable outcomes from the care that they're receiving. This was important for racial and ethnic minorities, people speaking different languages other than English as the primary language, and also for our rural and Appalachian communities, recognizing that culture plays a big role in how people seek care, receive care, and benefit from the services available in their communities. And finally, we made efforts to support first responders on the front lines, knowing that the stress that they live through every day responding to crisis, whether they're law enforcement, EMS, or firefighters, carries with it stress into their personal lives. And by making available technology and peer support and other supports, we've been able to help promote their mental health and wellness as they serve and meet the needs of all Ohioans as well. So where do we go from here? There's certainly some silver linings to this past year, despite all of the turbulence that all of us have experienced. We've found that we can enhance both our ability and capability to overcome adversity and build resiliency, and we've provided needed services throughout this time. We know that for most Ohioans, this pandemic is a temporary disruption to our everyday life, and a temporary point of stress, anxiety, sadness, or grief. But for some Ohioans, that will go on longer. We know that for those Ohioans already living with or recovering from mental illness or addiction, this added a layer of mental health concerns, emotional distress. And for those who experience these in a more significant way, it will be something that they need support for and recovery from over a longer period of time. We build on the lessons that we've learned. We build on the capacity that we built with technology, outreach, new on-ramps to care, better ways of reaching more diverse populations within Ohio and better meeting their needs. And we continue the important work to reduce stigma and to increase access to care. We know that none of this is possible without our local partners. At the state, we really believe that we are here to help facilitate good policy, strong resources, and accountability for those resources to make the work of our local partners easier to accomplish. You're setting the priorities, you're building the infrastructure, you're doing the work, and you're making a difference every day in the lives, and we're very proud to partner with you on that. We will continue to support you in your work, and we appreciate all of your engagement with us and efforts to help us build out a stronger infrastructure for the state of Ohio as well. As I wrap up, I'd like to take a moment to acknowledge Rhonda Meyer's work and her upcoming retirement. We want to thank you for your service to the community, your service to the state of Ohio, and wish you all of the best in the days to come. We hope you have an enjoyable retirement. And I want to close by thanking you again for all of your service, all of your support, all of your partnership over the past year and the years prior to that. We look forward for good things to come, and we know that we are stronger together. Thank you.
Thank you, Director Chris. Your work is enlightening and has given us all something to think about. I'd now like to celebrate the winners of the 2021 Friend of ADAMH Award. But first, a little bit about the award itself. This award is presented annually to individuals, agencies, groups, and organizations who embody the mission and vision of ADAMH. The ADAMH Community Relations Committee reviewed each of the nominations submitted by members of the public. In addition to the regular criteria for winning this award, this year's committee members wanted nominees to display excellence in mental health, substance use disorder treatment, or recovery during the pandemic. I'm excited to recognize the following selected recipients for their outstanding contributions and demonstrated commitment to the health and well-being of our community. Our first Friend of ADAMH is Megan Golden of New Horizons Mental Health Services. Megan is an experienced, connected mental health professional, social worker, and therapist in Fairfield County. One nominator said she works hard. Above all else, she puts the benevolence of the clients and the community as her first priority. While doing so, she is even able to support the growth, competence, and professional development of her team members. During the pandemic, Megan stepped up to provide the community with the best support and resources possible. Her work is all about helping others and providing positive, healthy outcomes for a healthy community. For these reasons and more, the Fairfield ADAMH Board voted Megan a Friend of ADAMH Award recipient. Megan?
I'm so honored to receive this award for our community, from ADAMH, for our agency, and I'm so thankful of all of the work that we've been able to do and come together even through this pandemic. And I am so excited to see what we have in store in the coming years for our community and our clients. Thank you.
Her next Friend of ADAMH is Dr. Angeline Sturgio of Fairfield Medical Center. Dr. Sturgio is a longtime community partner and advocate for individuals with mental illness and their families in Fairfield County. She has helped considerably with the development and operation of the Assisted Outpatient Treatment, or AOT program, addressing the challenging needs of some of our citizens struggling the most with their significant mental illnesses. Dr. Sturgio, the Fairfield ADAMH Board voted you a Friend of ADAMH Award recipient.
Thank you so much for recognizing my work here. And I'd have to say, in recognizing me, you've recognized me not just as an individual here in the community, but a member of an important team of people providing care. And it's been everyone really throughout the 25 years that I've been here, or actually close to 26. Everyone from the office staff, the emergency room, nurses, police, probate court, attorneys, family members. It's been a joy to work here, and thank you for the recognition. Wishing all of you a great, happy spring, a better summer, and hoping that we won't have to deal with masks for a long time to come. Thank you.
Thank you, Megan and Dr. Sturgio, for your outstanding service to our community. This year, I have one more award to bestow on behalf of the ADAMH Board. If you haven't already heard, ADAMH Executive Director Rhonda Myers will be retiring at the end of May. To honor her 28 years of dedicated service to Fairfield County, the ADAMH Board will be presenting the special 2021 ADAMH Award of Excellence to her. I speak for all of the board members when I say what a pleasure it has been to work with Rhonda over the years. On a personal note, I would just like to add Rhonda's dedication to this community is really something that I've admired. She is so passionate about mental health and drug addiction services in Fairfield County, and she reflects that every day when she comes to work. She works really hard at what she does, and I'm really proud to say that I have worked with her and enjoyed my time working alongside of her at the ADAMH Board. 2020 has been like no other. Thank you once again for your support of the Fairfield County ADAMH Board. We couldn't do what we do without you. I am Dr. Jonathan McCombs, chairperson of the ADAMH Board, and it has been my extreme honor to be your video host. Until next time, we wish you all the very best. Stay safe, and hopefully we will see you again in person next year.